In this edition of Simply Family, we wanted to show you how every member of your family can have a perfect smile no matter their age. We all know that dental care is very important for children, but what about the other members of your family? We came to downtown Springfield to speak with our friend Dr. Peck and find out how he can make every smile brighter. I'm here, like I said, with Dr. David Peck. Thank you so much for being on the show again.
Thanks for having me again, Maggie. Glad to be here.
Let's talk about your dentistry practice. We all know that you focus on cosmetic dentistry, but you also perform general dentistry as well, correct?
That's absolutely correct. The love of my life is cosmetic dentistry. Even though we focus on cosmetic dentistry, I really love doing all phases of general dentistry. And really, when you're doing cosmetic dentistry, it involves other phases of dentistry. So you can't just make a tooth look beautiful without looking at the patient's bite, how their teeth come together, whether there's fillings involved, whether someone needs a dreaded root canal, which we do painlessly, by the way.
Oh, that's impressive.
Yeah, that's impressive. Or whitening. So it's really a conglomeration of different things that we do. So that's why I love general dentistry, because I'm not just focused in one area of the mouth.
All right. As people age, is it true that our teeth become more brittle?
I think what it is that as we age, we might have more fillings put in them. And the more fillings in them, if they're the old type fillings like amalgam, silver fillings don't bond the tooth together. They actually act like a cutting down a tree where you're splitting wood. And so they will split teeth apart.
Oh,
yeah,
not good.
Not good. So what we use is adhesive dentistry, and we use tooth-colored materials which bond or hold the tooth together. So I think that as we get older, the wear and tear on our teeth, the silver fillings acting like a wedge, teeth break.
Now, if somebody has a misshapen or a broken tooth, you have solutions for that as well, correct?
Right. We have a lot of solutions. So they could have a filling put in it. If the breakage isn't that big, we could put a crown on that tooth to make it stronger. So again, even though the crown will be aesthetic and pleasing to the eye, it's to protect the tooth in function when they're chewing, because people like to eat. Yeah?
I would agree with that one.
So I do too. And so we want to make the tooth stronger, not weaker.
And as we become older as well, one of the things that I think is pretty popular with some of the older generations are dentures. Do you have a more permanent solution than...
Yeah. I wouldn't say that's something that people want, but sometimes the older generation, as you put it, 20, 30 years ago, that's the only thing that was offered to them. So today we offer implants, and we can put in anywhere from 2 to 4 implants and have the denture snap into the implants, so now they don't have to always use the Polydent or the C-base to hold the denture in. More importantly, when people wear dentures, Maggie, they lose their taste sensations.
Really?
Yeah. So the denture covers the whole roof of their mouth, and that's where all your taste glands are in the roof of your mouth.
I did not know that.
You didn't?
That's very
but
unfortunate.
You don't have dentures. You got beautiful teeth.
Thank you.
Yeah, you're welcome. So if we can cut away that part of the denture that covers the roof of their mouth, they're going to taste foods better.
Well, you all want that.
Yeah.
Come on. So if someone at home is considering cosmetic or reconstructive surgery on their mouth, is that something where you can kind of show them what it's going to look like before they do it? I mean, I would want to see.
Yeah, that's a great question. So people come in and they say, well, I want my teeth to look better, but they have no idea what they want it to look like. So I'll ask them, hey, bring in a youthful picture of yourself, maybe from 10, 20 years ago. But what we do is we take a really high quality digital image of your smile. So we frame in just your smile, your face, your teeth. Then what we do is we change the shape of the teeth, the color of the teeth, the position of the teeth. And we can show you pretty well what your new smile will look like. When you mean a better smile, a nicer smile, what do you mean by that?
Right.
Because everyone has different thoughts.
Yes.
And so it's not for me to just assume I know what you want, Maggie. I need to ask the right questions so that I can know exactly what you want. So in the end, we deliver exactly what you wanted. We want to satisfy the patient's wants as well as offer some of the needs that they have. But it's really important when a patient's done with whatever they do, even if it's a simple filling, that we listened to what they wanted from us, we delivered that, and they walk out with a smile and they're happy. That's the most important thing to us.
If you want your smile to be at its best for your next family portrait, there's only one person to call, Dr. David Peck.